Just Understand My Potential, or JUMP, is a non-profit organization with the mission of youth development through outdoor adventure. This video is intended for hike leaders to review the basics of medication administration, recognition and management of hyper and hypoglycemia in diabetic patients, and the indications and administration of an epinephrine autoinjector. Medication administration. When giving a hiker a medication, always remember the 5 R's. Right patient. You should identify the patient and ask them how they feel. Right medication. Check the label of the medication and compare it to the hiker's medication orders. Right time. Confirm that you are within the right time to administer the medication, such as before a meal or 6 hours after the last dose. Right dose. Read the order and check the medication label again. Then prepare the med properly. And right route. Read the med label a 3rd time and confirm that you are giving it as indicated. After administering a medication, replace it in the appropriate case. Document the medication administration in the log, including the date and time that the medication was given, the hiker's name, the medication given, the dose given, and the route. Hyperglycemia. Hyperglycemia is a condition where the body doesn't produce enough insulin, resulting in high levels of blood glucose. Hyperglycemia is a common condition in diabetic patients, but rare in non-diabetics. The symptoms of hyperglycemia include headache, fatigue, blurred vision, frequent urination, and frequent thirst. If you suspect hyperglycemia, check the patient's finger stick blood sugar. In diabetics, give the appropriate dose of insulin based on the FSBS finding, following the doctor's orders, which usually include a sliding scale of insulin dose dependent on the FSBS level. Follow the instructions for med administration reviewed earlier. Be sure to document the symptoms, the FSBS level, and the medication that was administered, if any. Hypoglycemia. Hypoglycemia is a condition where the blood glucose falls below the normal range. This is a common condition in diabetic patients after insulin administration, but is rare in non-diabetics. The symptoms of hypoglycemia include fast heartbeat, sweating, chills, clamminess, feeling lightheaded, dizzy, shaky, nervous, or anxious. If you suspect hypoglycemia, follow the steps to check a finger stick blood sugar. If the FSBS is less than 70, give 20 grams of a sugary drink such as juice or Gatorade, or a food such as candy or an energy gel. 15 minutes later, recheck the FSBS. If it remains less than 70, repeat step A above. If it is greater than 70, give the hiker a snack or a meal. Epinephrine autoinjector. Epinephrine, also known as adrenaline, is a hormone and medication that is used for, amongst other things, to treat severe allergic reaction called anaphylaxis. The symptoms of anaphylaxis include confusion, lightheadedness, dizziness, nausea and vomiting, swelling of the tongue and lips, difficulty breathing or shortness of breath, wheezing, difficulty swallowing, hives, flushing, blue skin, or mottled skin. If you suspect anaphylaxis, you should administer epinephrine. There are many types of epinephrine autoinjectors, including EpiPens, Auvi-Q, and generic epinephrine autoinjectors. In order to administer an EpiPen, you should first take the epinephrine autoinjector out of its package. Remove the blue safety cap. Hold the autoinjector in your fist. The needle comes out of the orange end, so be careful not to hold your hand over that end. Push the orange end with the needle firmly against the side of the patient's thigh, about halfway between the hip and the knee. You can give the injection through clothes or bare skin. Hold the autoinjector in place until all of the medicine has been injected, usually no more than 3 seconds. Remove the needle by pulling the pen straight out. A protective shield will cover the needle as soon as it is removed from the thigh. Pull the injector back into its safety tube. Massage the area after the injection. Instructions to administer AUVI-Q epinephrine autoinjector. Pull the AUVI-Q out of its case. Pull the red safety guard off. The needle will come out of the black end. Place the black end firmly against the side of the hiker's thigh, about halfway between the hip and the knee. You can give the injection through clothes or directly onto bare skin. You should hold the autoinjector in place for the 2-second countdown. Remove the needle by pulling the AUVI-Q straight out. A protective shield will cover the needle as soon as it is removed from the thigh. Put the AUVI-Q back into its case. Massage the area after the injection. Instructions for giving a generic epinephrine autoinjector. Remove the autoinjector from its protective carrying case. Pull off the end caps. You should then see a red tip. Grasp the autoinjector in your fist with the red tip pointing downward. Put the red tip against the middle of the outer thigh at a 90-degree angle or perpendicular to the thigh. Press down hard and hold firmly against the thigh for approximately 10 seconds to deliver the medication. The autoinjector is designed to work through clothing. Remove the autoinjector from the thigh. Massage the area for 10 seconds. Check the autoinjector's red tip. If the injection was administered correctly, you should see the needle sticking out of the red tip. If you do not see the needle, repeat step above. Autoinjectors should be stored at room temperature, away from heat, moisture, and direct light. I hope you have found this video informative and useful. Thank you for your participation with JUMP and providing an amazing opportunity for youth to explore the outdoors.